Welcome to Her Majesty's Superior Butcher Shop. Truly a medieval cave of charcuterie, where our butcher is hard at work preparing for a royal feast, and where we've carved out a sketch all about the superior vena cava. The superior vena cava, or SVC as it's commonly referred to, is the final vessel that returns venous blood from the head, neck, and upper extremities to the right atrium of the heart. The rest of the blood from the body returns via the inferior vena cava. To remember the areas drained by the SVC, peruse the finer meats in this butcher case: a goat head, neck, and arms. Okay, so goats don't exactly have arms, but they're like our upper extremities. Anyway, not to be outdone by lesser butchers of the royal court, this shop also caters to a variety of palates, including those with a taste for octopi. These two cephalopods are holding arms, or tentacles, to remind you that the SVC is formed from the right and left brachiocephalic veins. Brachio, like arms, and cephalo, like head, and also like cephalopod, hence the friendly octopi in this tank. Importantly, these veins are paired structures, unlike the arterial system, where there's only a single brachiocephalic artery on the right side. This shop may have the Queen's blessing, but it doesn't hurt to have a hype man trying to bring in some new business. Though it looks like that octopus would rather not have octopus sandwiches on a menu. Maybe not so friendly after all. The cephalopod is strangling this juggler, who is juggling sub-sandwiches, to remind you that each brachiocephalic vein is formed by the confluence of the internal jugular vein and the ipsilateral subclavian vein. The internal jugular is the main venous supply from the ipsilateral half of the brain and superficial face, and the subclavian vein drains the ipsilateral arm via the axillary vein. Oh, and the external jugular vein drains into its ipsilateral subclavian vein. So, each brachiocephalic vein drains an arm and half of the head. Ugh. Tentacles getting sucked into the filter, an octopus's worst nightmare. Whew. Hard enough for me to keep track of my 2 arms, let alone 8. If the superior vena cava is obstructed, like from a thrombus or compression from a nearby apical lung tumor, the blood can back up, causing venous congestion, called SVC syndrome. Patients get face and arm swelling, visible dilation of subcutaneous veins of the head and chest wall, headaches, dizziness, and even confusion. If the nearby trachea is also compressed by a tumor, it can cause a concurrent cough or shortness of breath. If obstruction occurs in the vessels that supply the SVC, symptoms are more localized. Unilateral symptoms suggest brachiocephalic vein obstruction, since they each handle half of the head and one arm. Obstruction of the subclavian vein can cause thoracic outlet syndrome, though that more commonly involves the brachial plexus and subclavian artery. Identifying the SVC on imaging is important as well. On an X-ray, the SVC forms the superior part of the right lateral border of the cardiac silhouette, the part that's parallel to the vertebral column. Once it starts curving, that's right atrium. The IVC, on the other hand, which we'll get to later, forms only the very short, most inferior portion of the right lateral border. On CT, the SVC is to the right of the heart, posterolateral to the ascending aorta, anterior to the right pulmonary artery, and just below the level of the carina. Not to get ahead of ourselves, but you may also see the azygos vein arching over to the right pulmonary artery to enter the superior vena cava. Why is imaging important? Central venous catheters, or central lines, are most commonly placed through the subclavian vein or the internal jugular vein and advanced until the tip terminates within the SVC, which is confirmed on imaging after placement, just like the tip of this pipe is terminating in the superior butcher shop cave. Central lines are placed for many reasons, including for hemodynamic shock, to consistently deliver medications like vasopressors that can't be delivered by peripheral IVs, and large amounts of IV fluids or blood. They don't come without risks, however. If they're in for too long, they can cause thrombosis that obstructs the SVC or brachiocephalic veins, like we mentioned earlier, depicted here by these sticks, our symbol for thrombosis, making up the rat's nest. Ugh. Probably best if the queen doesn't see that. Since the subclavian vein runs so close to the apex of the lung, improper placement can also puncture the lung pleura, causing a pneumothorax. Ugh. Each subclavian vein also receives lymph drainage just before joining the internal jugular vein on either side, returning lymph fluid back to systemic circulation. The right lymphatic duct only collects the right half of the head and neck, the right arm, right hemithorax, and right upper quadrant of the abdomen. To remember this, note the small size of this R-shaped duct. On the other hand, the left subclavian vein receives lymph from the thoracic duct. It's the largest lymph vessel and collects from all other areas of the body not drained by the right duct, including the entire left side of the body and the right side below the level of the umbilicus. The larger size of this left-sided duct should help you remember the lymph drainage pattern on the left side, even though he's on the right side of your screen since it's like we're looking at the patient. Since the thoracic duct is so important, injury, such as from surgery in the chest or less commonly in the neck, can lead to serious lymph leakage. If it collects in the chest, specifically the pleural space, it's called chylothorax, hence the milky fluid leaking from this duct. Duct. Don't slip. Now, let's switch gears a little and talk about an important sidekick to the SVC, the azygos vein, an unpaired structure running along the right side of the vertebral column. We mentioned him a little earlier. The azygos vein connects the superior vena cava to the inferior vena cava, providing a collateral pathway for blood in case either becomes obstructed. Since azygos sounds like zigzag, check out this zigzag rat tunnel connecting our superior cave to the inferior cave, just like the azygos vein connects the SVC to the IVC. The azygos vein is the main vein of the larger azygos system that collects blood from the thoracic wall via the posterior intercostal veins, similar to what these rib-like blue pipes are doing before draining their pipe contents into the zigzag rat tunnel. The azygos vein also collects thoracic and upper lumbar vertebral columns via the vertebral venous plexus, and minor venous drainage from the lungs and pericardium. In addition, the azygos collects from the esophageal veins, which anastomose with the left gastric vein. A goose is our symbol for the esophagus, hence this bird's draining some goose juice or blood into the zigzag rat tunnel as well. Ugh. Importantly, since the left gastric vein is part of the portal system, these esophageal veins can become variceal in portal hypertension, but more about that in another sketch. For now, let's recap. The SVC brings venous blood from the head, neck, and arms back to the right side of the heart, and obstruction of it results in venous congestion in those areas. The SVC is formed from the confluence of the bilateral brachiocephalic veins, which are in turn formed from their respective internal jugular and subclavian veins. Each subclavian vein receives lymph drainage as well, the thoracic duct on the left and the right lymphatic duct on the right. The thoracic duct is larger since it collects from the whole left side of the body and everywhere beneath the umbilicus. Finally, the azygos vein connects the SVC and IVC, and also provides venous drainage in the thorax, including the esophageal veins. Well, there's certainly more than meets the eye in this cavernous butcher shop. If only Her Majesty knew how much effort or studying goes into the hors d'oeuvres.